Coming up, coronavirus is taking a toll on New York State's budget. Find out what priorities might be on the chopping block.
Plus, how the bidding war for crucial medical equipment like ventilators has impacted New York hospitals.
And how the hospitalization of UK's Prime Minister Boris Johnson is impacting the country. This is Talking Points. The New York legislature passed the state's annual budget last Friday after promises of spending cuts in the wake of the COVID-19 pandemic. Governor Andrew Cuomo was quick to admit the difference between this budget and the one he proposed in January, but also maintained that, quote, "this is a moment in history unlike any other." Joining us now to discuss is Talking Points analyst Augustus LaRue. Gus, thank you so much for joining us.
Thank you very much.
So it's obvious that this coronavirus pandemic is definitely impacting this latest budget. What do you think are some of the key changes we're seeing now compared to what was originally proposed?
Well, I think the key components you really have to look at in this budget are Medicaid and education. Medicaid received about $2.5 billion in cuts just for this annual budget alone. Education as well, seeing a massive drop in funding. We're encountered what many lawmakers had hoped would be a massive and very revolutionary fiscal year for the education budget in New York. Obviously being met with a lot of disappointment and criticism among lawmakers, though Andrew Cuomo was quick to respond that these programs will be receiving federal funding. Let's take a listen.
The federal government has passed a couple of pieces of legislation. They're planning to pass another piece of legislation. It's very important that whatever legislation they pass helps.
Now, obviously, these drops in funding will not be total as in $2.5 billion in Medicaid. There will be some relief coming from federal funding, as the governor just said.
Now, Gus, some significant cuts there. Have we seen much of a public reaction so far?
Well, yes, as said before, there's obviously a lot of criticism coming, especially from lawmakers. Well, obviously, a lot of relief is going to be coming from this budget. In particular, in regards to Medicaid, a lot of people are dishing out criticism for, in a time of a medical health crisis, why $2.5 billion is being taken away from this Medicaid program. Once again, the governor was quick to respond to criticisms, highlighting the current situation in New York.
The budget was difficult because the state has no money. And how do you do a budget when you can't really forecast?
Now, also in the face of education, while obviously there are some deficits there, while there is still criticism coming from that fact, a large majority of the population is understanding given the circumstances.
Now, Gus, do you think that this is going to be enough to help the state deal with the COVID-19 pandemic? Obviously, New York is one of the hardest states hit by this.
Well, obviously, you have to think in terms of what is the best we could hope for right now. And obviously, New York is going to be grappling with this severely for some time to come. At the same time, though, we're also seeing in this new budget a tax freeze on all classes, lower, middle, and upper classes, that should provide some relief to individuals who would otherwise be financially struggling, that will not have to anticipate any increases in their tax rates this upcoming fiscal year.
Now, Gus, it's difficult to look at anything that isn't related to the current pandemic, but is there anything that you noticed in this budget that is notable that really doesn't have much to do with the coronavirus?
Right, and obviously a lot still carried over from Andrew Cuomo's initial proposal in January. We're seeing a lot in terms of drug laws in New York, and particularly the child vaping laws that were proposed went into effect. We're seeing a lot harsher regulations being put on those vaping and tobacco products. We also saw there was a lot of talk earlier in the year about the potential of legalizing recreational marijuana in New York. We're seeing those laws and those proposals being thrown right out the window in an attempt to get this budget through. The budget deadline was, in fact, April 1st. It passed April 3rd, so we saw, obviously, the urgency from lawmakers to get this budget passed, which obviously led to a lot of those proposals being eliminated outright.
All right, Augustus, thank you very much for joining us.
Yeah, thanks, guys.
As states across the country are scrambling to find the ventilators they need, many are finding they have outbid their neighbors and even the federal government to try to get these crucial devices. Talking Points analyst Rob Flax joins us now to discuss what this bidding war means for patients. Rob, thank you so much for joining us.
Happy to be here.
Now, Rob, how exactly did this bidding war take place, and what has it done to the prices for these devices?
Right. So what's happening is with these very limited supply chains that are actually able to deliver these ventilators immediately, while GE and General Motors have pledged to start building these devices. Those are weeks away. So what states are relying on are those ventilators that are already available. And a lot of them are coming from China. So what's happening is these vendors are making these states and even the federal government in the form of FEMA bid against each other to try and get these devices. What started as 20,000 grows to 30,000, and in the cases of the few ventilators that are still available, it's over $50,000. Now, understandably, this leaves states that are lower on the income bracket that can't afford these devices woefully unprepared for the shortages that are going to come for this, and those are relying on the federal government and their stockpile that might not make it to them in time.
And Rob, what does it actually look like on the ground in states like New York, which we know, again, has been very hard hit by the virus?
Well, for specifically New York, Governor Cuomo this morning issued an update as to how they were doing.
Equipment, that's the protective equipment, ventilators where we are stretching and moving, but every hospital has what they need to date.
Right. Now, the reason that they were actually able to, as he said, stretch and make sure that all hospitals are meeting their standards is because of a couple of factors. Number one, he says that social distancing is working, and that means that while there are still new people showing up to the hospital, the rate of increase of these new people is remaining flat and more manageable for hospitals. More importantly, Gavin Newsom, the governor who's proposing that states should band together and sort of price fix these vendors to make sure that they all kept together and kept those prices low, realized this plan was no longer going to work because there were so few ventilators. To circumvent this, he decided to send New York as well as other hard-hit states. Specifically New York, he sent them 500 ventilators. Those are going to use and are staying in the stockpile. Now, the question for New York is, they had a stockpile before, and the reason it was liquidated was it was so costly to maintain. So can New York take these 500 ventilators and keep them in good enough shape so when they actually need them, they're working and they can get them to the patients?
Now, obviously, any sort of lack of equipment like this is going to put strain on the hospital system. What kind of level of care can we expect from the hospitals in the days coming forward?
Well, guys, I was able to speak with a senior administrator and a ER doctor from a prominent Long Island hospital, and they told me that at the moment they are relying on their county and the state of New York to get them those ventilators, and they're going from the stockpiles. Now, understandably, because of this very costly acquisition, that's going to put a lot of costs, and it has to be paid somewhere. They said that their hospitals are the ones that are going to be fronting that cost, and at the moment, there's going to be no patient coming into their emergency room, ICU, or inpatient facility that's going to be denied these things as a result of the cost. They're giving it to everyone who they want, who they can give it to. They're trying to uphold that level of care, and they're trying to make sure that while that cost will eventually be paid down the road, they're not even thinking about it, guys. All the equipment that they do have, they're making sure it gets to the people that need it.
Well, still early days, but certainly some positive signs there. Rob Flax, thank you so much.
Thank you.
The spread of COVID-19 across the nation has called for many businesses to close temporarily. And even for the ones that haven't closed, they find themselves in need of support. This is no different for medical practices that offer elective procedures. Talking Points analyst Natalie Fahmy spoke with two doctors about their struggle to receive federal aid.
For ophthalmologist Dr. Assad and gastroenterologist Dr. Fahmy, empty parking lots and scarce waiting rooms are the new normal for now. This means less revenue was brought into their private practices, which are considered small businesses. So now they look to the federal government for financial help. And Drs. Assad and Fahmy say the process hasn't been easy.
It seems like you're just going to click the button and the money's going to be transferred into your funds. However, that is not true at all.
It is not outlined properly to us or to the bankers.
They are among thousands of Americans who have applied for assistance, such as the Small Business Administration Energy Paycheck. Dr. Assad says she has had to lay off 3 employees because of the delay in federal aid.
I do have numbers for both of the programs that I've applied for, but I've not seen any cash flow.
And Dr. Fahmy says not only was the process to apply difficult, but they're also being left in the dark.
We have no guidelines about when are we going to hear about that, or is there a timeline for that? We have no idea.
There's over $300 billion of relief allocated for small businesses in America. For more information about how you can apply for a loan, you can visit sba.gov. Reporting, Natalie Fahmy, CitrusTV News.
UK Prime Minister Boris Johnson is still in the ICU after being hospitalized 3 days ago. He was initially hospitalized after his coronavirus condition worsened. The UK cabinet has since had to rally without a clear path forward in the country's unwritten constitution. Talking Points' Michael Fernari is here with more on Johnson's condition and how the UK has reacted with their Prime Minister in the hospital.
This morning, the BBC and other UK news outlets reported that Prime Minister Boris Johnson is in stable condition in the intensive care unit. They say his fever, one of the primary symptoms of coronavirus, has dropped, and he is breathing without assistance. Johnson is the most high-profile world leader with a serious case of coronavirus, and his stay in the ICU has raised new questions about how government functions in a situation like this. The person who's been designated to take over many of Johnson's duties in the interim is First Secretary of State Dominic Raab. Raab has reportedly been leading the government's daily coronavirus briefing meetings. The question that has arisen is whether or not Raab actually has the authority to make key decisions in this time of emergency. Soon, the UK government will have to make decisions about extending or shortening UK lockdowns, and at the moment, it's unclear who will be making those decisions should Johnson remain unavailable. Business Insider reported that Raab is something of a divisive figure within the cabinet, as he's one of the lesser-known and more inexperienced members of the cabinet. Should Johnson become too ill to govern, Raab will step in and become the prime minister, without an election immediately following. What remains unclear is the threshold that Johnson's condition would need to fall below in order for such a measure to be considered.
The outbreak of COVID-19 is a health crisis, but it's also bringing along economic uncertainty. Traditionally, as the weather heats up, so does the housing market. Talking Points analyst Manny Martinez joins us now to discuss the virus's impact on that housing market here in America. Manny, thank you so much for joining us.
Yeah, thanks so much for having me.
So obviously the main concern right now across the country is still flattening that curve and making sure people are staying inside and keeping up with social distancing. But what are some places doing to protect the homeless community, who, as we know, is a community that's at greater risk of both contracting the virus as well as spreading it?
Yeah, absolutely. One example is the city of San Jose in California, spending $17 million on hundreds of tiny homes for the homeless. And normally, according to the mayor, it would take years to build and to go through with it. But San Jose is putting it on the fast track, and they want a target completion date that is not months away, but just weeks away. And also the mayor is looking at something that would be able to last a decade or so. So this is something that wouldn't just be for COVID-19. And then also in California, Los Angeles wants to use 15,000 hotel rooms for its homeless population. That would only cover about a quarter of that population, and they would be specifically for the particularly vulnerable. And LA began this plan 5 days ago, and they expect over 1,300 rooms to be in use by the end of this week. Mayor Eric Garcetti says he still wants to expedite that process.
Now, Manny, in normal times, someone looking forward to their next rent paycheck or for being able to pay off their mortgage, these are things that weigh on people's minds, again, in a normal situation. These aren't normal times. We're on the verge of economic collapse. So what kind of help are renters and homeowners getting at this time?
So homeowners in particular are struggling. Just in the past 2 weeks at the end of March, mortgage payments, the request to delay them skyrocketed by 1,900% over the norm. And it's clear that people need help. So the CARES Act that the president signed into law at the end of March mandates that all borrowers with government-backed mortgages, so about 62% of all first lien mortgages, according to the Urban Institute, will be allowed to delay at least 90 days of monthly payments, maybe even up to a year's worth. And so for the other 38% of homeowners, what does that mean? That means you're going to have to call your lender for a forbearance request, and that is getting increasingly difficult just with the volume alone of all the calls. And then as for renters, it's tough times ahead. The National Multifamily Housing Council says 31% of renters did not pay on time for the month of April a week ago, and that's up from the usual 20%. Congress did call for a ban on evictions on top of the $1,200 stimulus checks that are supposed to help Americans stay afloat, but who knows if that's enough.
So generally speaking, this time of year, mid-spring, coming up on summer is peak housing market season. What is the outbreak doing to the housing market right now?
Well, it's really slowing it down big time. Capital Economics predicts that home sales will fall 35% this spring when compared to the same quarter of last year. Even if people are interested in buying or renting, just getting to an open house is proving to be difficult. Realtors and landlords are having to scrub down and ensure places are squeaky clean for each visit. And the National Association of Realtors says half of their surveyed agents reporting a drop in buyer interest.
Now, what does this mean for students in the housing market?
So this is one demographic that so far has been kind of glossed over, but it's a pretty big one. And a lot of students are at home right now learning online, but they still have leases around campus that they are still being held accountable for. And there's really no help from the stimulus checks because a lot of them are excluded, especially if they're not listed as, if they're listed as dependents. They will not be getting those $1,200 coming from the government here in April or in May. So they're locked in, and there's really no sign of help coming from for students.
Certainly tough times. Manny, thank you so much. Various states across the nation have had various responses to the coronavirus outbreak independent of the federal government. Here from Los Angeles to break down the state response is Talking Points analyst Spencer Queskin. Spencer, how are you?
I'm doing very good, Connor.
All right, well, let's get to it. So what states have been the most aggressive against the coronavirus?
Yeah, so actually New York State has ranked for the most aggressive response to the coronavirus according to a recent Wallet Hub survey. Now, Governor Cuomo has enacted a wide variety of restrictions and laws, and he's also had a record amount of tests for the coronavirus within the state. In New York City specifically, Mayor Bill de Blasio has ordered a $500 fine for those violating the social distancing order. Now, if we take a look to the other side of the nation, California has also had a very strong response to the coronavirus. Governor Newsom has ordered a statewide stay-at-home order like New York, and Los Angeles County, which has been particularly affected by the coronavirus, has issued some more orders. Eric Garcetti, Los Angeles County Mayor, said this yesterday. Additionally, Riverside County, which is just outside of Los Angeles County, has issued a $1,000 fine for those not wearing face masks in public.
All right, Spencer. So we're talking about both New York State and California, as you said, very aggressive in combating this coronavirus, implementing shutdowns and stay-at-home orders. On the other side of the spectrum, what are some states that have been a little bit less aggressive when it comes to sort of tackling this virus head-on?
Yeah, so you said it, Sabrina. Some states really need to be more aggressive in tackling the virus head on. For example, Florida, they failed to shut down their beaches during spring break, which allowed a number of individuals to possibly get the virus and then transmit it later. Additionally, Florida failed to issue a stay-at-home order until only last week, which is a big problem. But even bigger of a problem is Oklahoma. Oklahoma has not yet issued a stay-at-home order yet. Instead, they have only opted to recommend those over 65 to remain at home. Arkansas is another state that has not yet issued a stay-at-home order, and some non-essential businesses within Arkansas, like clothing stores, continue to remain open within the state. Now, there are many states that have not issued a stay-at-home order yet, and those are North Dakota, South Dakota, Nebraska, Iowa, and Arkansas, while Utah, Wyoming, and Oklahoma only have stay-at-home orders in only parts of their state, not the entire thing.
All right, Spencer, thank you very much for keeping us updated on that, and we'll see if their policy shifts in the coming weeks.
All right, thank you so much.